Today we're going to be talking about the most common reasons for failing the USMLE Step 1. If you failed Step 1, you know you're not alone. You will need to make some significant changes to your study plan for a second or third or fourth attempt at Step 1. Here are the top reasons for failing USMLE Step 1. Trying to cram. USMLE Step 1 is a marathon, not a race. Ideally, students should begin studying for the exam on their first day of class in medical school. However, this probably doesn't happen with most. Students who try to cram all of their studying for the exam into their dedicated period of time, which for some students is as short as 5 weeks, is a recipe for disaster. If you have failed Step 1, recognize that you will need plenty of time to study before attempting it again. Using too many resources. Commonly, students who fail Step 1 have tried to use all the resources available, but haven't used the two primary resources thoroughly, First Aid and UWorld. Getting distracted with lower yield resources can detract from the usefulness of your primary resources. It will require significant dedication and lots of hard work. If it were easy, everybody would be a doctor. Not using NBME practice exams to track your progress. NBME exams are excellent predictors of actual Step 1 scores. Students who have failed Step 1 often have not used NBME exams appropriately to predict if they were ready to take USMLE Step 1. An NBME exam should be taken approximately every 1 to 4 weeks. And last but not least, stuff got in the way. If you know that you haven't had time to prepare properly for the USMLE Step 1 and your NBMEs aren't where you want them to be, do not take the exam, just to get it over with. It is better to delay the exam than to take it prematurely and receive a failing or barely passing score. If you avoid these 4 common pitfalls, you will be setting yourself up for success. That's all for today's video. You can read the full article at the link below. Best of luck studying.